Hello and welcome back, and we are back with another video of blepharoplasty, and today we'll be presenting you another client who was suffering from this eye bags. And you can see his before pictures. He had huge eye bags and he did not like them. He did follow us through our YouTube channel and through Instagram and got in touch with us. What we did for him was our standard surgery, that is the transconjunctival blepharoplasty along with fat grafting. So guys, if you see clearly, there is a eye bag which is there in his under eye area, and this eye bag needs to be treated. So many a times patients, they try to get it camouflaged with a filler, but for eye bags which are this huge, which are this big, you need to get rid of the fat, you need to get the fat removed. And once the fat is removed, then you can opt for something to fill in the under eye area to give a more better shape to your whole facial structure. So guys, for him we did a blepharoplasty to remove the eye bags, and we did it from inside the eyelid so that there is no cut given on the outside. And once the eye bags are removed, and this is the quantity or this is the amount of eye bags that we were able to retrieve in his case, and once that is done, we always try and augment the cheek area or the mid face area with fat grafting. But you need to understand, when I'm combining the two surgeries, the swelling and everything will remain for about 7 to 10 days, and this is how he is about a week's time. And there is certain amount of bruising and swelling which is still persistent in his case, and it will take about 3 weeks for everything to settle down. If you are suffering from eye bags, or if you need to know anything about periorbital rejuvenation, be it upper lid bleph, lower lid bleph, fat grafting in the periorbital area, you're always welcome to contact us. Thank you and have a nice day.